Lifestyle changes. Not everybody is meant to be thin or looking like an actor. We are going to be all shapes and colors. I have been in practice for close to 30 years doing general pediatrics, and then I was the director of the local children's hospital ambulatory services. So I dedicated myself to the clinics, and that is when I noticed a tremendous increase in the number of obese kids. Obesity is a very complex problem, and it starts obviously with the genetics. Putting an individual that is genetically predisposed to be obese in what we call a toxic environment, we have a time bomb. This is what has happened with certain ethnicities. When you put them in a toxic environment that provides all the fast food, all these sugar drinks, all the fatty stuff, together with lack of exercise and difficulty access to a good, healthy lifestyle, we created a time bomb, and here we have the epidemic of obesity. We designed the program so that we give 8 weeks of intense education on nutrition, physical activity, and we also very early in the game tell them that this is not a babysitting program. This is a program where everybody needs to participate.
My name is Mimi Anzaldo, and this is my daughter, Lane Anzaldo. Lainey had expressed an interest in learning more about food and getting more exercise.
I look at exercise as something that the kids need to do every day, that they need to integrate into their life.
There you go. 17. There you go.
They do it, and when they come back at 8 weeks, they achieve exactly what we tell them that we expected to achieve. And I see this every day. It's not an uncommon event. I think that anybody that is involved in healthcare should assume the responsibility that obesity by definition is an illness, and we have to be honest with our patients and make them aware that although their children may have no symptoms and appear to be totally normal to the parents, take the time to explain to them that these kids are on the path to a very significant life of disability. And I will give this general message to everyone, the poor, the rich, the affluent, the not so affluent, that you need to face this. Otherwise, we are heading into a life of serious complications. For many years I've been seeing that we are neglecting one generation. I think that the kids we're dealing with are very smart and very intelligent, and those that do not succeed because the environment around them is not one that is conducive to success. Whatever that is, the home, the school, the city, it doesn't matter. The fact is that we are not all together trying to support the effort of these kids. Politics are very important, so what we're trying to do is create an influence on the legislators to make them understand what the magnitude of the problem is and how important it is to create influence on cities so that they make better planning, better use of their facilities, and then they help us create laws that benefit the kids in the end.